Infertility is typically the woman's fault.
Wrong.
Couples should always try for at least a year before seeing an OBG.
Wrong.
Women can't get pregnant after 35.
And when I say lifestyle changes, it is diabetes, hypertension, obesity, you name it, it has an origin to your lifestyle.
Using birth control can cause infertility. Irregular menstrual cycle is equal to infertility.
That's a misconception.
Certain sex positions improve the odds of pregnancy.
Abnormal sequence of genes is removed, the normal sequence of genes is put in, and therefore that abnormal embryo becomes the normal embryo. So in that way, you do not discard that embryo. So that's called gene editing. There can be only two sets of people who don't have stress. One before you're born and then after you're dead.
Hello, Namaskara. Welcome to Akey studio with me, Ritu Dravid. I'm here at the Medline Academics to interview Dr. Kamini Rao, a Padma Shri awardee. She is a pioneer in the field of assisted reproduction in India. She is an expert in reproductive endocrinology, ovarian physiology, and assisted reproductive technology. And some of her early achievements is the establishment of South India's first semen bank, South India's first babies born through sperm injection, and also India's first SIFT baby. She's also the chairperson of the International Institute of Training and Research in Reproductive Health. So welcome to the show, Doctor. Dr. Modern lifestyle changes have brought about a lot of issues among young adults and teenagers. So what are the changes that you have seen, doctor, with respect to reproductive health? So and how can you assist these patients?
Well, first of all, I wouldn't call them patients.
Okay.
I would call them, as colleagues, or I would call them as, people who are quite ignorant of what foods can do to us. In fact, foods are like medicine. I mean, they have to be eaten in the right proportion. And how foods can actually help us avoid medicines. And over the years, if we were to look at the times, perhaps in the early 1900s, there used to be so much of clean air, clean water, and of course food, not adulterated by a whole lot of preservatives, the heat and eat, the Swiggies, Zomatos. So it used to be fresh food, freshly cooked, and you wouldn't have kept everything in the refrigerator for 2 days, 3 days, or put into all these cellophane packets and sort of stored. So therefore, you didn't have to worry about the stale food. Today, because of the lifestyle changes and the fact coupled with a lot of pollution and a lot of the particles of combustion that take place in the atmosphere, we are left with a lot of pollution which adds on to the impurities in the water, and of course the lifestyles that we lead, the timings of our food, which is also important, not only the quantity, the quality of the food and the time at which we eat the food, all that rolled into one has made our diets very unhealthy. And when we talk about unhealthy diets, we keep saying that, okay, fine. The average middle class family today eats outside at least 3 times a week. In fact, most of the buildings today, the kitchen has become smaller and smaller, and now it's become open. Earlier it would be the God's room that would have a nice place, and then you would have some area where you could put those photos. But today a God's room is reduced to a small cupboard. And the kitchen has become an open kitchen, and
Right.
finally it's reduced to just some kind of a water heater, and then perhaps a few plates, and then place for getting all these foods from outside. So this is an evolving genre of people who are now looking at more on how to conserve space, and perhaps a day will come when the kitchen will actually disappear from the houses, and we would find more of Zomatos coming in and of Swiggies coming in, and we will find that a lot of the additives that are found in the food is all getting into our tummy. And this is what we are going to see, a lot of changes in our diet, which not only affects our health, our even fertility or our fertility status. And when I say lifestyle changes, it is diabetes, hypertension, obesity, you name it, it has an origin to your lifestyle.
Right, doctor. So when you spoke about unhealthy food habits, so what about factors like, you spoke about pollution as well. So what about factors like stress, inadequate sleep, and a lot of women are exposed to technology and social media. So they spend more number of hours, on basically viewing things on screen. So more screen time, less duration of sleep. So the sleep patterns have all changed. So how important is sleep, and what role does it play in perhaps say fertility issues in women?
I think if we were dividing the 24 hours a day and we put this into 8 hours of sleep per day,
Okay.
and 8 hours of work, and then 8 hours for our other activities, we have to keep some time for family time, some time for the work time, and then some time for the food time. And we have to tell ourselves, look, when you actually look at your work, then give the hours of work. See, our whole body has a circadian rhythm, and when it is night and when it is day, you can't say that I'll do what I do at night during the day and day during night. So when these people have night shifts, they actually take some time to adjust. And once they adjust to the night, and for them to change to the day shift, they take some time to adjust. So the circadian rhythm in the body keeps changing. So therefore, those people who particularly have shifts, who work towards the UK time and the US time, do have problems. And this is what we say is chrononutrition. Now, chrono is time and nutrition. This is a new concept that has come up in our diet, which says it's not only the nutrition. If you have a healthy nutrition, imagine if you suddenly say that I'm getting up at 2 a.m. in the night and I'm going to have a bowl of salad. It's not the same as having salad at 2 o'clock in the afternoon or 12 o'clock in the afternoon, because the steroids in your body that are going to be active are also having a certain pattern. 8 in the morning, 12 noon, 4 o'clock in the evening, or 4 a.m. in the morning, they're all different. And that, coupled with stress, is a perfect combination for disaster. So what is happening today is, how do you measure stress? Now, there is some people who can manage stress so beautifully that we think that they don't have stress. But there can be only two sets of people who don't have stress. One before you're born, and then after you're dead. Otherwise, between the two, you always have stress. So it is how you are going to deal with stress. So if you are going to deal with stress by breaking it into small parts and say, I'll deal with this first, this first, this first, then you're able to deal with stress. But if you keep all the stress together and say, how will I deal, then you're going to be paralyzed. So stress is going to be a very major factor, very abstract, and it depends upon the person to whom we are talking to. And so that stress is a very nebulous term, loosely used, but it is applied to the person we are talking to. So a good counselor will be able to talk to the person concerned, that you remember when they come to see you that you are treating the mind and the body. Please don't be organ specific when you talk to the patient. Please be person specific, because the person comes in and has a kind of feelings when they come to see you. Don't treat them that I'm just going ahead and treating either the ovary or the uterus, or I know I'm just going to treat the heart, or I'm going to treat the blood pressure, because behind that could also be a lot of psychological factors. So we have to tackle that first. Therefore, so many of the diseases that I'm seeing today is psychosomatic. So you have to treat the mind and the body, and that is how we go.
Okay. And with respect to a lot of young adults and teenagers getting into smoking, drinking, and even vaping, so and it's due to stress. So, and they are not aware or probably ignorant about the issues affecting their health, particularly reproductive health, okay, in women and also men. So how does infertility play a role here, doctor?
In fact, many a time, if you see, this overnutrition has played a very important part. Many people think that being obese, like chubby cheeks, dimple chin and all that, that was once upon a time considered very
Cute.
good, is not good. Because, when you have, children that are fat, and then the mother would say, I was also fat, so you are also fat. But the fat children are the ones that are later going to become diabetic. And now today, with a lot of IVF taking place, many of the IVF babies that are born obese or born heavyweight, like over 4 kilos, are known to be having the disease of diabetes at the time when they were conceived in a petri dish. So, fetal origin of adult disease. So, when we talk of polycystic ovaries and we talk about those people who conceive through IVF, we find that that gene for diabetes is carried even at the time of the embryo, when it gets implanted into the uterus. So therefore, we are not only talking about lifestyle after they are born, but we're even talking at the time of fertilization.
Right.
So we have to be very, very careful today that the mother has to take care of herself, that she doesn't overeat. We also have to see that there is adequate weight gain, but not too much of weight gain during her pregnancy, so that the baby that is delivered also remains healthy.
Okay.
So it starts way back in the womb, and therefore the WHO, which is the World Health Organization, defines the first 1,000 days of the child's journey from the 0 months in the uterus to 9 months, and then first 2 years of after birth, that this period of 1,000 days is very important, because the brain development is after birth for 2 years and 0 to 9 months when the baby develops in the womb.
So you were talking about factors right from conception up till
the WHO and that 1,000 days.
Yeah. So what about genetics playing an important role?
So therefore, what happens is that 1,000 days that we were talking of would roughly be the 9 months of intrauterine life plus 2 years. So the first 2 years of the baby's life is very important. So taking that into consideration, that also plays a role in infertility.
Okay.
So when we talk about polycystic ovaries, or we talk of ovulation disorders, or we talk about late conception or period problems, we can actually put that down to the genetics or epigenetics when we talk of environment, and we are making sure that these children try to not have all this pollution, etc., because those are multifactorial problems. If you're saying that we're talking about genetics particularly for infertility, yes, there are genetics specifically like chromosomal disorders, and these chromosomal disorders could be due to structural variations in the chromosomes, either of the mother or of the father, and that can be transmitted if they are unbalanced translocations to the child. And if there are some monogenic abnormalities like thalassemia, sickle cell anemia, hemophilias, sickle cell diseases, and of course muscular dystrophies, and many, many more, over thousands of diseases, then one can understand that these diseases in the past would only be treated by saying, okay, I'm sorry, try again. But
Right.
today we have enough of mechanisms to actually look into the embryo and identify whether that embryo is abnormal or not, and pick up the right embryo and put back into the uterus, so the person has a chance of having a normal child.
So is that done through your assisted
Yes.
reproductive technology?
It's not only assisted reproductive technology, but beyond that, to check every embryo whether it has a faulty gene or not. So if you find a faulty gene in that embryo, we discard that embryo and we go ahead with embryos that don't have the faulty gene, and then transfer that embryo back into the uterus.
Okay, doctor. And so what are the latest technology or advancements in that specialized field that you are an expert in?
Well, there has been a lot of advancements in this field. One is, of course, looking at these genetic abnormalities and helping to solve this problem by either removing these faulty genes, embryo, discarding them, and then putting back the normal embryos, or gene editing, which means that if you have very few embryos and you can't actually discard them, then you use the CRISPR technology and you edit the genes and just snip off that portion of the gene that is abnormal, and you insert the corrected sequence of genes,
Okay.
and then allow that embryo to continue multiplying, which means that the abnormal sequence of genes is removed, the normal sequence of genes is put in, and therefore that abnormal embryo becomes the normal embryo. So in that way you do not discard that embryo. So that's called gene editing. So
Is that the latest technology?
that
doctor?
is a CRISPR technology, which is gene editing, and this, what happens is, that is also loosely termed as designer babies.
Okay.
Okay, so people talk about blue eyes and blonde hair, but well, that is not what we are using it for. We are really using it for, the purpose of trying to take out any faulty genes. However, we also can look at it where mothers have certain mitochondrial diseases, which is certain organelles in the cytoplasm of the cell, that is the oocyte. And so what we do is, we actually replace in the egg only the cytoplasm and take the cytoplasm only of a younger woman. And so here you have a woman older woman whose nucleus is there, and the cytoplasm is that of a younger woman. So the nucleus of the intended woman is taken out and injected into the egg, minus with the cytoplasm, but you have the nucleus of the actual person who wants to get pregnant, but into the cytoplasm of the person who's donating that egg. So you'll have three DNAs, that is the father's DNA, then the one who has donated the cytoplasm, so that the cytoplasm which contains the mitochondria will not have the person who has been affected with problems, and the nucleus of the woman whose nucleus has not been affected, but the cytoplasm has been affected. So in a way, three-parent babies which they talk about is nothing but taking out the affected cytoplasm and replacing it with normal cytoplasm of somebody else, and therefore the child that is born will have two women and a man. So you'll have material of three genetic people, and that is to take out any mitochondrial disease, and we have had such babies being born in the UK and very successfully so. Looking at this again, another advantage that I see is that we are now looking at what happens if a baby is born with a thalassemia, which is a blood disorder. Now, the only way this child will survive is to have repeated blood transfusions because the child becomes anemic. But if you want to cure this child, you have to have a perfect blood typing, HLA typing, where you can remove this blood of this child and infuse fresh blood, which will be of the healthy blood. For that, you need a child which will have the same HLA of the affected child. For that, you need to create an embryo which will match this embryo and will not reject the blood. So, you can create an embryo by actually creating many embryos and then testing the HLA of these embryos to match with the affected child. Once you find the embryo which is normal and which is matching with the affected child, you can then put this embryo back into the mother, and when the child comes out, you can take the cord blood from this mother, the baby, the cord blood, and then you can do a bone marrow transplant into the affected child and remove the blood of this child, affected child, and infuse this blood, bone marrow, into the affected child. So what happens is the affected child's affected blood is removed and this pure blood is put in through the bone marrow. What happens in the end is that the affected child gets well, and this child which is born is also healthy. So this is called a sibling savior, which means that this sibling is born to save the other sibling. And that also happens. It happens with hemophilia, it happens with thalassemia, it can happen with sickle cell, and therefore those procedures are also done. The idea being that why should the mother suffer? Why should the affected child suffer and then go for a normal baby? If you can have a normal baby to help the other abnormal baby to become normal, so it's a kind of a bingo. You can have both the babies being normal, and this also is possible.
Right, doctor. So it is very important to bank the cord blood cells.
Yes.
Right? So in case of any such things,
yes,
it can be utilized.
Yes.
Okay. And a lot of young women, or of the or women of the reproductive age, used to visit gynecologists and fertility experts because of issues that they had post marriage. But now we see more and more patients visiting fertility experts in their late 20s and early 30s. Not only women but also men. So what are the fertility issues that men face?
Well, many times it would be sexual dysfunction. Many times they would also have problems with low sperm counts, or they would have masturbation problems, guilt complexes, no stable marriages, or they would have had a marital discord, psychological problems, and of course there would be times when you would have this thing with perhaps azoospermia. They would have been told it's azoospermia, or they would have had a vasectomy before, and then now they get married because obviously he's gone through a divorce and he's getting married a second time, so he would like to make sure that he can bear children again, so he wants to go for a reversal. So in that way, wherever there is a possibility, men hardly come to the clinic as a first choice, but they do follow the woman, and these would be some of the things. The point here is that men also should understand that if they came along with the women, or they also come independently, the entire process of infertility treatment becomes that much simpler.
Yeah. So what are the footfalls you see, between your women patients and your male patients?
I think for every 2 women, I would see 1 man.
Okay. So that's the ratio
Yeah.
you see. Right, doctor. And there are a lot of misconceptions about fertility and infertility. So I have a list of questions to ask you, and either you can quell or you can agree to them. Okay. So, and some of them being infertility is typically the woman's fault.
Wrong.
Okay. Couples should always try for at least a year before seeing an OBG.
Wrong.
Women can't get pregnant after 35.
Wrong.
Using birth control can cause infertility.
No.
If a man can ejaculate, he's not infertile.
That's a misconception.
Okay. Irregular menstrual cycle is equal to infertility.
No.
Fine. Infertility can't happen in young men and women.
That is also a wrong, it's a misconception.
Misconception. Certain sex positions improve the odds of pregnancy.
It depends for what reason they want to do that. If perhaps there is difficulty in having sex, maybe in that case, yes. But otherwise, if they can have sex the normal way, that should be good enough.
Okay. So it does not play any role in
Well,
getting
I
pregnant.
do not
it's only a
think
pleasurable
that.
act.
It's a question of preference.
Preference, right, doctor. So infertility is always fixable.
Again, it depends upon the problem. Like if they have something which is not fixable, like the man has absolutely no sperms and the woman has had a hysterectomy,
Right.
or has had a problem, they can go in for third-party reproduction, yes, provided they can follow the laws of the land, then yes, it can be fixable. But again, I would say, let's look at the problem, and then I would like to keep a guarded answer for this. I can't give a blanket yes or no.
Okay. Right, doctor. So your overall health does not impact infertility.
Well, that also is not true. It does impact infertility. Depends upon what the problem is.
Right, doctor. And if you can afford expensive procedures like IVF, you shouldn't consider treatment.
No.
The normal treatment.
No, I think you should go through the simpler treatment first before IVF, and IVF is not an answer for all infertility.
Right, doctor. And you are a doctor. You're a daughter of a very eminent gynecologist, Dr. P.R. Desai. So he's, I think, the first male gynecologist from the state of Karnataka, and he's also held the post of the Director of Health and Family Welfare. So how has he played an important role in your life, influencing your life? You're of the same profession, so can you just comment on this?
Yes, I think he was the Director of Health Services and Family Planning Services, though we were 5 children in the family. And I think very early on in life, he always put it in my head that there is no other noble profession other than medicine, and I used to keenly observe at home. We used to have a clinic at home, and he used to finish his government job by 4 o'clock, and he used to see patients, and I used to keep wondering, a lot of them used to come with a big tummy, and then after some time I used to see that the tummy has gone. So I used to tell my father, where did this tummy go? And then, he says, no, they have delivered.
Okay.
And then if they have delivered, that means you will not get any more money. He said, this is not for money, dear. This is that they are going to have a baby. Then after they had babies, they didn't come to the outpatient because he only had an outpatient clinic. And then slowly, as I grew older, my father used to take me for small procedures, and he used to make me stand by the side of him. And then he would make me, sort of assist him. And then I was wondering, I was fascinated, and the way he used to talk to the patients, he used to counsel them and used to make them feel comfortable. There were a lot of, marital problems. There was a lot of pain in the tummy, bleeding problems and all. And for the first time, I started understanding the physiology of the person, and I was only about 11 years.
So among the 5 siblings, you're the only doctor who took up
No,
the same
four
stream?
of us took up medicine,
Okay.
but I was the one that was very early on interested.
Right.
And to be fair to my father, he was selectively promoting me in this field, and he would promote me in front of all his colleagues, and he would keep searching for me wherever I was and call me up and say, "Come and meet my colleague." And so all of the others were all hiding behind, in the backyard and all that. But he'd pull me out, whatever it is, and introduce me. So I sort of got very bold, and I started, sort of conversing with him and, talking whatever little bit I could do, but which he thought was very interesting. And I did want to do organic chemistry though.
Okay.
And I did learn French.
Okay.
And I wanted to sort of go abroad and teach French. But my father was very, very strict. And he said, nothing doing, you are going to do medicine. So that's how I got into medicine. I don't regret it though. But if he had not really coerced me into doing medicine, perhaps I would have found myself in a different field.
Different field, okay.
And having said that, yes, he was instrumental in getting me into medicine and into obstetrics and gynae. The infertility part, I put myself in that after obs and gynae, because I thought I wanted to do something different and something which would make, a kind of difference in the life of women. Not that they just come pregnant and I deliver them. For that there are so many people. But can I make that difference to women who have been suffering, and I can bring some light into the family? And I thought infertility is the best thing. There are some procedures, there is some science there, and of course there's social justice will be given, and the position of the woman in the family will be enhanced. I thought I will be helping the whole family, and that's how I took infertility, and I came in.
That's such an interesting
when
story
nothing
you
was
have to
available.
share. Right, doctor. And you have been a beacon of light and hope to many, aspiring parents, wanting to have a baby. So, and you also extend a lot of emotional support, you and your team. So how has the journey been so far? You have 40 years of experience, doctor. So there must be some, defining moment in your life that, a very rewarding moment over the last 40 years. So is there anything of that sort that you can share to the viewers?
I think there are not one, there are many. I mean, one thing when you're actually treating women, I think don't be judgmental. I think first listen, don't be in a transmitting mode. Because when you start looking at the patient, you've already made up your mind what to treat them. I think first, be a good listener. Because many a time, just listening to them, and when they try to bring out their inner feelings, many of the patients just want a patient hearing. Because they go from doctor to doctor only because they have not actually taken the burden of being heard.
Absolutely right.
And I think that is the most important thing.
And I second that, doctor.
It's very, very important. And second point is, do not thrust your judgments before they have finished talking, because they lose their train of thought. Also, be very watchful of their movements, their eye movements, and their facial expressions on what they are not saying rather than what they are trying to tell you. The power of silence and the language of silence is much more stronger than the spoken words. Because not everything a woman can say in front of her partner. And that over a period of time you will understand. Even her mannerisms as she sits there and talks is totally different. If I see a person walking into the room, I can immediately tell you that here is an oppressed woman. When the incidence of domestic violence is almost 1 in 2, how can you say that a woman has not gone through domestic violence or harassment? And if all the time you're just looking at your paper or your phone ringing or a telephone or a nurse knocking on the door or a junior doctor coming in and disturbing you, how will you ever understand what she wants to say? As it is, she comes with such great difficulty to come to a doctor because of the taboo. You'll never be able to understand. So my dear friends, and my message to all of you is, do not treat them as outcasts. Don't treat them as a piece of business. Try to understand them. That will be my message to you.
Yeah, doctor. And one more question, doctor, about cervical cancer in India. It's affecting a lot of women, and a lot of them are ignorant about it. So can you just give us a word of caution or advice on cervical cancer?
Yeah. Cervical cancer is a very, very prevalent cancer among women, almost the second highest cancer next to breast. And what is really sad today is that cancer can be diagnosed easily, and if one pays attention to it, and the gynecologist at every stage can pay attention to it, I find that this can be diagnosed early. Now, we also have a vaccine for cervical cancer, and just like we give the tetanus toxoid, we give the polio, we give German measles, etc., we also can give the HPV vaccine, and this should be given around the age group of 11 to 13 years, and mind you, it can be given for boys and girls, this HPV vaccine. It's important for us to understand that this HPV vaccine is the human papilloma virus vaccine. There are certain components of that vaccine which are the harbingers of the cervical cancer virus. So, it is given before the onset of sex, before intercourse. So, girls, before starting any relationship, this should be given. Otherwise, the antigen test for HPV must be done. So, I would urge all women to get the HPV done for the girls, and then get the HPV vaccine given to the child. This way, it will be able to prevent 80 to 90% of cancer of the cervix in future. Even a pure visualization of the cervix at the time of your pregnancies, at the time after delivery, or any time you have any vaginal discharge, make sure you get it completely treated. Any abnormal bleeding or bleeding after sex is also not to be lightly treated. You need to check it and make sure there is nothing sinister going on. Any intermittent bleeding that you have which cannot be identified, biopsies of the cervix must be taken and analyzed to make sure there's nothing sinister. It doesn't mean that every time you have any abnormal bleeding that the uterus must be removed. Not at all. But complete checkup must be done. Very, very important for us to make sure that cancer of the cervix can easily be cured if it is detected early. So my message to all of you is, many unnecessary early deaths from cancer can be prevented, and a lot of lives can be saved.
Yes, doctor. And the HPV vaccines, can they be administered at the age of 40, 50 even?
The vaccine can be given at any age, but you need to test whether you are already affected with the HPV.
Okay.
And if you are already infected with HPV, then there is no need to take the vaccine.
Right.
If you are not infected, then you take the vaccine.
Okay. So thank you, Dr. Kamini Rao, for giving us a beautiful interview and sharing your thoughts. And I'm sure the viewers will be benefited out of this. And you've thrown a lot of light around infertility issues, both for men and women. and you've been a beacon of light for a lot of aspiring patients and put a lot of smiles on their faces. And not only a beacon of light for such patients, but you've also trained and tutored a lot of, a lot of fertility experts around the world. So thank you so much for your time with us, and it was a pleasure.
Thank you.
Thank you.
I am Dr. Kamini Rao, and I have been interviewed by Akey Studio. I would love to have you watch this very informative talk on infertility and on women's health, and it would give you a lot of information. Thank you very much.